Carnitine comes from the Latin word carnis, which means flesh. L-carnitine is a nutrient produced by the body which helps the body to turn lipids into energy. It is present in foods such as beef and can also be taken as a dietary supplement. The body produces L-carnitine from amino acids lysine and methionine. It is stored in the muscles, heart, brain, and sperm. L-carnitine is important in the oxidation of fatty acids in the mitochondria into energy. Mitochondria are the powerhouse of the cell. L-carnitine carries fat across the mitochondrial wall from the cytosol. It is also believed to be useful in the treatment of health conditions like infertility, acute kidney diseases, cardiac and vascular conditions, and thyroid disorder. Forms of L-carnitine. L-carnitine is the natural and the most abundant form of carnitine found in foods, the body, and supplements. Other forms of carnitine are acetyl L-carnitine, propionyl L-carnitine and L-carnitine L Tartrate. Acetyl L-carnitine. Carnitine helps in the metabolism of fats. L-carnitine produced from the amino acids lysine and methionine carries fatty acids across the mitochondrial walls. The fatty acids enter the mitochondria, they are oxidized and turned into energy. The byproducts of this process are acetyl groups and other trace compounds. The acetyl group produced in the metabolism of fats enzymatically reacts with L-carnitine in a process known as acetylation to form acetyl L-carnitine alcar and leaves the mitochondria. Enzymes can convert alcar to L-carnitine and back depending on the needs of the body. They are both similar, but alcar is easily absorbed and can also cross the blood-brain barrier more than L-carnitine. Propionyl Lcarnitine. This is another form of L-carnitine formed by the body. It is formed by enzymatic actions on L-carnitine just like in the formation of acetyl L-carnitine. They can also be converted back to L-carnitine if the body needs to. Propionyl Lcarnitine is used in the treatment of leg pain, atherosclerosis, diseases of the heart, and the blood vessels. It is used by men to treat diabetes-induced erectile dysfunction when combined with other drugs. A combination of propionyl Lcarnitine and acetyl L-carnitine has been used in the treatment of symptoms of low testosterone in men and fatigue. Propionyl Lcarnitine injections can be used to treat peripheral vascular diseases (PVD), heart failure, and angina. It also increases the production of nitric oxide, which helps in the reduction of blood pressure by dilating the blood vessels. L-carnitine L Tartrate. This is a combination of L-carnitine and tartrate and has antioxidant and anti-cancer properties. L-carnitine is a carrier molecule for the long-chain fatty acids LCFAs as they go into the mitochondria of cells to be metabolized into adenosine triphosphate ATP. Tartrate is a salt of tartaric acid. L-carnitine L Tartrate is useful in fatty acid metabolism, reducing the formation of free radicals in the body. The prevention of fatigue during exercise. It is also used to reduce muscle weakness, peripheral neuropathy caused by chemotherapy and hyperlipoproteinemia. Benefits of L-carnitine. Although it has been established that L-carnitine plays a vital role in the production of energy from fat metabolism, there are other benefits attributed to it. They are: 1. Improved athletic performance. Some athletics involve themselves in L-carnitine supplementation because it is believed to increase endurance in sports and rigorous physical activities. This benefit might take a few weeks of using the supplements before they can be manifest. Studies suggest that the ability of the supplement to provide endurance is by increasing oxygen supply to the muscles and increasing the ease of blood flow through the production of nitric oxide. It is also believed to reduce fatigue, muscle soreness, and support the production of more red blood cells. 2. Cardiovascular health. Studies have shown that L-carnitine could be used to effectively manage cardiac ischemia and peripheral arterial disease (PAD). Cardiac ischemia is the reduction of the flow of blood to the heart due to the blockage of the coronary arteries. The peripheral arterial disease occurs when the blockage of the arteries prevents the flow of blood to the leg, resulting in intermittent claudication. Claudication is caused by the insufficient supply of oxygen to the legs by the blood. Due to this, acetyl L-carnitine accumulates in the leg muscles because it is not completely utilized. This makes a person with peripheral arterial disease (PAD) unable to engage in physical exercises. Studies, however, have shown that L-carnitine can enhance the effects of the leg muscles, decrease pain, and boost overall well-being. There is a significant drop in the blood level in the blood when the heart is failing. So, supplementing with L-carnitine is believed to greatly reduce the fatty acids and carbohydrates in the blood by inducing their metabolism. Chemotherapy, lack of appetite, and radiation treatments of cancer can cause fatigue. This is because some healthy cells might have been affected together with the cancerous cells. The body is, therefore, working harder to repair damaged tissues, thereby causing fatigue. Studies show that supplementing with L-carnitine could reduce fatigue, muscle soreness, improve mood, and help in getting restful sleep. This is done by the increased metabolism of fatty acids and carbohydrates to produce more energy. 4. Increased nerve health in diabetes. When there is a fault in the oxidation of fatty acids in the muscle, insulin resistance could occur, leading to type 2 diabetes. When fatty acids are not metabolized as they should, they get stored in the lean tissues of the body, which is always noticed in type 2 diabetes. Supplementation with L-carnitine could increase the metabolism of these stored fats and also lower the level of glucose in the body, by increasing their oxidation in the mitochondria. 5. Reduction of lipodystrophy in HIV/AIDS. The white blood cells die apoptosis when the body is infected with the human immunodeficiency virus HIV. This leads to acquired immunodeficiency syndrome AIDS. When a person is living with HIV, some parts of the body accumulate fats while some parts lose fat lipoatrophy. This increases the level of fat in the blood and results in hyperlipidemia. This condition is also associated with insulin resistance, and they lead to lipodystrophy syndrome. Lipodystrophy is a genetic or acquired disorder that causes fat to abnormally accumulate at a part of the body. Supplementing with L-carnitine could lead to increased fat metabolism and also slow down the death of white blood cells associated with the human immunodeficiency virus. 6. Relief from renal disease symptoms. The balance in the blood level of L-carnitine might be affected by dialysis used in treating kidney diseases. Other factors like low consumption of animal products or poor appetite could also contribute to low blood levels of L-carnitine. This deficiency could lead to a range of health disorders like fatigue, anemia, heart disorders, muscle weakness, and increased level of fats in the bloodstream. These symptoms associated with renal disorders due to L-carnitine deficiency can be reduced by L-carnitine injections. 7. Improvement of sperm quality. The L-carnitine found in the seminal fluid is believed to play a vital role in the motility of the sperms and improved sperm count. This is because it helps to increase the breakdown of sugar and fats on the mitochondria of the sperm cells, thereby producing more energy for them to move further. Studies showed that supplementation of 3 grams of L-carnitine per day for up to 2 months could increase the motility of sperm cells and treat male infertility. It was also known to reduce the sperm cell death that takes place in the testes. 8. Weight loss. Since L-carnitine works as the conveyor belt that carries fats into the mitochondria to be metabolized, it is believed to play a vital role in weight loss. There is evidence that increased intake of L-carnitine could lead to increased fat metabolism. Supplementation can increase the concentration of this compound in the blood and the muscles, thereby leading to enhancement in the rate of fat loss. 9. Reduction of the effects of aging on cells. The production of energy by cells reduces as one ages. The inability of the mitochondria to produce enough energy leads to the production of free radicals. These highly reactive nitrogen and oxygen damages the enzymes and the DNA of the mitochondria, leading to mitochondrial dysfunction. This occurs mainly at old age and leads to senescence. Senescence is the inability of cells to divide and grow. This is also caused by stress from DNA damage, and it is an irreversible condition. Senescence can cause inflammations and other hyperplastic abnormal cell growth and division diseases. Supplementation with L-carnitine will inhibit the enzymes that cause senescence, known as senescence-associated beta-galactosidase. It also gets rid of free radicals that lead to cell aging and death, such as 4-hydroxynonenal subunit expression and highly reactive oxygen species. How to take L-carnitine supplement. Take an L-carnitine supplement with 60 to 80 grams of carbohydrates such as glucose to increase the concentration of the compound in the blood. For best results, L-carnitine is taken with glucose because insulin, which also transports glucose into the cells, is also responsible for its transportation to the muscles. Once carbohydrates are consumed, the body produces insulin in preparation for its transport. Taking the supplement orally has been proven to increase the concentration of L-carnitine in the blood. It is advised to take the supplement for up to 6 months before evaluating its effectiveness. The supplements come as a capsule or powder that can be mixed into beverages. The doses are 600 to 2,500 mg acetyl L-carnitine per day and 1,000 to 4,000 mg of propionyl L-carnitine should be taken per day. The best time to take L-carnitine supplement for fat loss and endurance in sports is before the beginning of the exercise. The supplements should be taken after exercise if the purpose is to enhance recovery. If the purpose of taking the L-carnitine supplement is for weight loss, endurance, and recovery, the doses should be split into 2 and taken before and after the exercise. Accompanied by a source of carbohydrate, it is best taken with a meal and at any time of the day. If you found this video helpful, click on the subscribe button below. Turn the notification on, so that you will know once we post a new video. Do not forget to visit our site, www.zymsupplementsguide.com for more supplement content like this. Thank you.